Good afternoon, ladies and gentlemen. Welcome to the KNH webinar. Today, we are going to start a series. Good afternoon. Welcome to KNH-UoN webinar. Today, we're going to start a series on the ear and hearing. And as we all know, today is World Hearing Day, and the theme is integrating ear care and hearing care within the primary health care. And our speaker today is Sarah Ndegwa. Sarah Ndegwa is a university lecturer in University of Nairobi. She's been in University of Nairobi for the last 12 years. She did her clinical audiology in University of Manchester. She also serves as the secretary of the Kenya Society of Audiology and is a co-founder of the Cochlear Implant Group of Kenya. She's a course coordinator in the Public Health Planning and Hearing Department in Impairment course at the University of Nairobi. And she has vast experience in matters ear, also a member of the WHO Technical Working Group on EHC, service delivery in low and middle income country, and a hearing health advocate with the Coalition of Global Hearing Health. So Sarah, welcome. It's quite a pleasure to have you and to share insights on the many years of experiences you've had on matters hearing, and we can't wait to hear more. The floor is yours, Sarah.
Good afternoon, everyone, and thank you very much for the opportunity to make this presentation. This presentation is basically about World Hearing Day, which is upcoming on the 3rd of March. And so this is the first part of the series of presentations that we are going to be making in line with ear and hearing care. So the topic for my presentation is World Hearing Day 2023. The World Hearing Day is an integral annual global advocacy event for raising awareness on hearing loss and promoting ear and hearing care. It's also a call to action to address hearing loss and the related issues. In this year, we have a theme, and the theme is ear and hearing care for all. Let's make it a reality. Hearing loss is on the rise, and therefore countries must act now to provide access to ear and hearing care for all. So by 2019, the estimated population globally that had hearing loss was 1.5. 2030 estimated to be 1.9 billion. By 2040, 2.2 billion. And it's estimated by 2050 we'll have 2.5 billion people with some degree of hearing loss. Therefore, countries such as ours must begin to plan and act now. WHO estimates that 466 million people have disabling hearing loss, and 80% of this global burden is found in low and middle income countries. By 2050, nearly 1 in every 4 persons will be having some degree of hearing loss. 1 in every 2 young people will have some degree of hearing loss. 1 in every 3 people will require ear and hearing care services, with 1 out of every 14 requiring hearing rehabilitation. Therefore, this is really a call for action and planning now. So over 60% of hearing problems can be identified and addressed at the primary care level. Integration of EHC within the primary care is an essential component of universal health coverage. This can be achieved through training and capacity building at this level. On the 3rd of March, which is this coming Friday, WHO will launch a training manual, which is also going to be accompanied by a trainer's handbook and other community resources. I beg to stop sharing because I think what I've uploaded is not the presentation that some things are missing. So I beg your pardon for a short while.
No problem.
Let me stop that. Look for the right presentation.
Sarah?
Yes, a second, please. Countries must act now to provide access to ear and hearing care for all. It's estimated by the year 2050, nearly 2.5 billion people will have some degree of hearing loss. The ear and hearing care is an integral component of universal health coverage with the goal 3 of the Sustainable Goals for 2030. WHO has adopted an integrated people-centered ear and hearing care approach with ear and hearing care services included in national health plans to ensure that those affected have equitable access to hearing care and also to the continuum of care across the life course. And they coined a phrase which is called hearing, where here H stands for hearing screening and intervention, E stands for ear disease prevention and management, A stands for access to technologies, R for rehabilitation services, I for improved communication, N for noise reduction, and G for greater community engagement. So this is the public health approach for intervention for ear and hearing care that the WHO is trying to rally countries and governments towards, and that is an integrated people-centered ear and hearing care approach. So in terms of causes of hearing loss, 60% of the causes of hearing loss are preventable, with 31% being due to infections such as measles, mumps, meningitis, measles, and other ear infections, 17% being due to birth-related causes, and 4% due to ototoxicity, and 8% due to other causes, and only 40% due to non-preventable causes. The Kenya Health Information Survey 2021 found that 15% of people above the age of 50 years have some degree of hearing loss. So what is the impact of unaddressed hearing loss? One is difficulties in communication. One is not able to hear the other, what is being spoken to them, and that can cause issues, even in terms of social withdrawal, embarrassment, and so forth. So difficulties in communication. For children, delayed speech and language development. And this is one of the commonest reasons as to why children will will have a delay in speech and language. Having a hearing loss is one of the commonest reasons why they will have delayed speech and language. And then because of that, you have language deprivation, which then in turn leads to a delayed cognitive development. And then that comes along also with poor academic performance. There is also social isolation that's associated with unaddressed hearing loss and feelings of loneliness. We talked about embarrassment. There's also quite a bit of social stigma and rejection of people who have hearing loss. And then with that also comes minimal employment opportunities. There is also a negative economic impact of unaddressed hearing loss. It has been estimated that it will cost the world almost 980 billion annually due to unaddressed hearing loss. The good news is that effective and timely interventions can benefit all those who are at risk of hearing loss or are living with hearing loss. And this through ways like screening, which is going to be dealt with in subsequent webinars, can be done across the life course, that is all the way from newborns and infants, that is through newborn hearing screening, and then also to those children in preschool and school-age children, persons who are exposed to noise or chemicals at work, and people who are receiving ototoxic medication, and also now the older adults. So in this year's theme, this ear and hearing for all, let's make it a reality. You say over 60% of ear and hearing problems can be identified and addressed at the primary care level. Therefore, integration of EHC within the primary care is an essential component of universal health coverage. This integration can be achieved through training and capacity building at the primary level. On the 3rd of March, this coming Friday, WHO will launch a new training manual, which is known as Primary Ear and Hearing Training Manual. With it, it will come with a trainer's handbook and other community resources, which we are going to look at. So in making this a reality, there's a call to action, and some of the communication objectives that have been provided for us is, one, to engage governments and decision makers, whether they're in central or county government, in integrating ear and hearing care into primary health care. In 2021, the Ministry of Health appointed a focal person for ear and hearing care at the Ministry of Health, and subsequently also a technical working group was formulated by the Council of Government.
Sarah, you're breaking on my end. Sarah? Again, many apologies. I think she has to log back in. In the meantime, maybe just a brief. We're now on Instagram and on TikTok. We are hoping to expand our social media presence to be able to make the content in our social media platforms more targeted to healthcare workers, because the other forums are usually generally for everybody and anyone. So do reach out, let us know, give us feedback so that we can improve and become better and in areas of exploring. So kindly follow us on our YouTube page, on our Twitter page and Instagram and TikTok, as we put in more local content in healthcare related activities. As I wait for Sarah to join in, as of last week, we were at 29,000 people who have signed in on the database for our Zoom platform. Most of the time, we have up to 1,000 people listening in. About 7,000 doctors, 7,000 nurses, farm techs and pharmacists come up to almost the same 5 and 7,000 as well. So it's a growing community. The nutritionists now probably will start growing as well. They had a much lower number. And we are hoping we expand with the lab as we are getting the CPD approvals for lab. And we've also been giving a lot on the CPD points. I hope it has increased because I've also noticed we're not also being asked a lot about it. So bear with us. We are constantly working. In fact, the research team, Nelson and Dr. Kinuthia and everybody is constantly working to make the service much better. And we are here to serve. So as we wait for Sarah to log in, I can even see Jacinta today is on. She's the one who normally gives you the CPD points. And thank you very much, Jacinta. Let me call her now because I think it's a bit longer than normal. But yeah. Yeah, and sorry for that. For anybody who would like to present on research on this platform, we're going to have a dedicated email, but for now you can send in your request. If you are physically in Nairobi, you can come to KNH Research Department, but you can also email KNH Research. I'm sharing the email to everybody so that you can reach out to the research department to be able to, if you'd like to present something with your topic and what have you, it will be free for you to do that.
You see my presentation?
Yes, Sarah, thank you. Welcome
Oh,
back.
wow. Oh my God.
We thought we'll have hearing
This is just
problems,
not
but
my
it
day.
seems like we're having visual hearing, all
Oh
sorts of
my
problems.
God.
Yeah,
I'm so sorry. So,
but please go on.
thank you. So in this year's theme, in line with this year's theme, there is a call for action. And the way to do this is through engagements with government. So we have been engaging the government. The Ministry of Health appointed a technical working group as well as a focal person for EHC. And through the whole of last year and this year, we have been working on 2 documents, that is reviewing and updating the National Strategy for Implementation of Ear and Hearing Care 2023-2028, and also national guidelines for implementation of ear and hearing care in Kenya for the same 5-year period. And in this review, we had stakeholder engagements, and these stakeholders were some from the Ministry of Health, Ministry of Education, the academia, University of Nairobi, University of KU University, KMTC, Kenya Institute of Special Education, NGOs like CBM, Operation Eardrop, and many other stakeholders. So that is one of the things that we are going to be launching on World Hearing Day. It's a big step forward for EHC in this country. The other important thing, in line with the theme of this year, which is also integrating ear and hearing care into primary level care, is advocating for integration of EHC into training programs for primary healthcare workers. And we have been holding stakeholder meetings with some of the institutions, such as Kenya Medical Training Center and College, and they are willing to take up some of those trainings. The other important thing in being able to make EHC a reality is to create awareness among primary healthcare providers on the needs of people with hearing loss and ear disease. And as well, this training manual is going to be available, and you can all have access to it. And then the other thing is also community engagement, informing people about the importance of ear and hearing care and encouraging them to seek services, and also to form, let's say, lobby groups or groups that can be able to push forward for their needs. There's a lot of materials that are available also for advocacy, such as this one, tips for healthy ears, the use of earplugs, the importance of the use of earplugs in noisy places, checking of your hearing regularly. The WHO has an app which you can download as well that helps you to check your hearing, about wearing hearing aids regularly as advised, and also to seek a doctor if you have an ear or hearing problems. So in this training manual that is going to be launched on the 3rd of March, it is a practical guide on prevention, identification, and management of hearing loss and common ear diseases. The target group is health workers at the primary care level. Along with this training manual are some resource documents, and one of them is when to suspect a hearing loss in an adult. Another one is when to suspect a hearing loss in a child. Another one is the care of discharging ears. Community resource number 3 is on hearing and language milestones in children. And I've just picked on that one as an example. I've picked on that one as an example. What are some of the things that you can look out for in the milestones of a child and act early? Remember, early detection and timely diagnosis and intervention is key. So, for example, a child with normal hearing, by the age of 3 months, they should respond to the mother's voice and make cooing sounds. By the age of 6 months, they should move their eyes in the direction of sound, making bubbling sounds such as baba and papa. By the age of 1 year, they should turn when someone calls by name and understand common words like bye-bye and mama and dada. By the age of 2 years, they should respond to simple questions like who's that, where is that, and so forth. So this training resource material provides all this information. Resource number 4 is on tips for hearing aid users, and resource number 5 is on tips for safe listening. So the World Hearing Day is upcoming, and there are some of the activities that we are going to be having are: 1, we are going to be launching the National Strategy for Implementation of Ear and Hearing Care and the guidelines for implementation of ear and hearing care for 2023 and 2028. These documents will be disseminated to some of the invited people representing counties. The other document that is going to be launched on the 2nd of March is the one on disability guidelines and categorization. There are 6 domains, and one of the domain is hearing and speech and language. And so that also is going to be launched on Thursday. So these are major strides for us in ear and hearing care. And then, of course, we are having this webinar series. Today's webinar series was going to be addressing integrating ear and hearing care within primary care. And next week on Tuesday, we'll be diving into the national strategy and the guidelines for EHC to look at what is contained there and what information you can get from that. And then we have another one coming up on Tuesday, the 14th, that is on early detection of hearing loss across the life course, how we go about that from newborns, infants, school children, and adults. This one is not only going to be about detection, but is going to be about also timely diagnosis and intervention and the referral pathways. And then on the 21st of March, we'll have about safe listening. And on 28th of March, we'll have on otitis media, diagnosis, and management. The panelists who are going to be speaking to us are Mr. Manasseh, who is the focal person, head of clinical services at the Ministry of Health, Dr. Lilian Moko, who is an ENT surgeon at Kenyatta University, Professor Macharia, professor at ENT department, ENT unit, Department of Surgery, University of Nairobi, and Nancy Kemuntu, an audiologist at Kenyatta National Hospital. Another very important thing is media advocacy in terms of also creating awareness. And we have had opportunity in past times and even this time where we are going to be having some discussions or media presentations. There's, for example, one coming up with the Kamba TV station where Alex will be giving a talk there. We're also having one tomorrow morning with NTV. So be on the lookout for all the media advocacy that is going out there. And we just want to encourage you as well to be able to do the same in your local area, wherever you are in your counties. We'd like to have this advocacy also in the vernacular as well. So this is a call again to use this medium as a way of creating awareness. Countrywide, we'll be having ear camps, and these ear camps are in schools. And like, for example, Strathmore partnering with KMTC will be going to Kitui and Machakos School for the Deaf. We have hearing screening going on at Mama Lucy, also Mwai Kibaki Hospital in Kenyatta Hospital in Othaya, Makueni County, Engineer County, Gertrude's Children's Hospital. There are various hospitals that have informed us that they are going to be having this screening activity, and we are encouraging more people to come out and do the same. We'll also do screening in offices, and one of the places we have earmarked is the Parliament, where we have our legislators, and that will also give us an opportunity to be able to create awareness to them as the lawmakers and decision makers on the issues to do with ear and hearing care and how it can be integrated into primary health care. So the activities basically will be hearing screening, also giving health talks and appropriate management for basic ear conditions and referrals. World Hearing Day forum. We have a World Hearing Day forum, and the participants in this forum, which is an open forum, many more can join, are the Ministry of Health, University of Nairobi, Kenyatta National Hospital, Kenyatta University Teaching and Referral and Research Hospital, KMTC, the Nairobi County, Makueni County, Impact East Africa, Kisii Teaching and Referral Hospital, Nakuru County Referral Hospital, Moi Teaching and Referral Hospital, Machakos County Hospital, Kiambu County Hospital, and maybe there are many others who are yet to join and are doing an activity around World Hearing Day. You are very welcome to do that. We'd like to acknowledge our sponsors, the WHO and also CBM. These have been very instrumental, especially when it was in terms of helping us to review and update, sponsor the review and updating of the strategic plan and the guidelines, and also Medel and Widex for sponsoring some of our meetings, including the launch, Operation Eardrop for logistics, Optica for their medication that they are providing us with, and also Strathmore University for organizing for 2 camps in Kitui and Machakos School for the Deaf. For those who are yet to register your events, we'd like to put together all the events that are going to be happening in the country. This helps us also to be able to provide some data or information to the Ministry of Health, as well as also to channel this to the World Health Organization. They have a platform in which we'll be sharing with them all the activities in the different parts of the country that we'll have conducted. You may also register your events with Dr. Lilian Moko on that phone number that's on your screen, or Nancy Kemunto. Thank you very much. And sorry about all the hiccups that we've had this afternoon.
Thank you very much, Sarah. Thank you very much for the elaborate explanation on the events that is happening. What is happening on the background, because most of the time as healthcare workers, we're not fully engaged and we're not fully aware, rather, of what's happening. And we can't wait for the launch. I hope you'll be able to share with us the soft copy so that we can be able to circulate as well for all the audience to be able to access the information. And you have questions from the audience, and I'll start by Jalab. He asked, amongst the causes of hearing loss is occupational related noise induced hearing loss. I don't know if we have any statistics on such hearing loss. So I hope you understood the question.
Yes, I did. Yes, I did.
Yeah. Thank you.
That is a major problem in our country. Although we have less legislation around noise-induced hearing loss in this country, the most difficult part of it is the implementation of the same. For example, over the years and many World Hearing Days, we have done screening, hearing screening amongst the Jua Kali workers in the informal sector, where there is a lot of noise exposure up to even 110 decibels. If you're hearing more, if you're exposed to more than 85 decibels of hearing loss, whether recreational or whether occupational, potentially you will develop a hearing loss, and it's just a matter of time. And what we have seen and noted is that, especially amongst the informal sector, they do not wear protective protective devices to protect them from excessive noise exposure. At least there is a little bit of good framework within the formal sector where the hearing conservation programs have been set in place, and with some of the companies, for example, this is being enforced. But by the larger public, this is unknown. And when we talk about noise-induced, we also factor in recreational noise, like whatever activities that you might be doing that will lead to excessive noise exposure. Amongst the jua kali, we found that 20% of those in a study that we did with the Retirement Benefits Authority have some degree of hearing loss.
Okay.
Thank you. Thank you.
Yeah, thank you. I think it's fully understood. Then I think Dr. Zainab Esaji from COST is asking, is this activities organized at a cost?
What we do, yes, there is a cost to all these activities, but fortunately we have some sponsors. And what we encourage people is that wherever you are in your hospital, you might even get the sponsorship from your own hospital. Usually we are all volunteers as the human resource. For example, I'll give a typical scenario in where we are in Nairobi Forum, where we have a team from University of Nairobi, from Kenyatta National Hospital, Nairobi County. We all come in as volunteers, but we might get some med reps or drug reps to provide us with medication. And in this case, we approached Optica. They gave us, some eardrops. But really, it's all based on a volunteer basis. CBM has come up for us very strongly over the years in providing us with advocacy materials. These are the infographics and posters and so forth. And this can be availed if you ask in good time and make arrangements to get them to yourselves. And even though you may not get them by the World Hearing Day, but they're very good posters with good information to be able to put in your clinics or setups. So really what we encourage people is to, first of all, come with a volunteer spirit. Whatever you are, the work that you're doing around this World Hearing Day is really volunteer. But then because resources are required, it means that you may need to look for sponsors around your area to support you. And we have always found a lot of support from people. Like, for example, some of the TV shows, which ordinarily would be paid up for, they're being given to us at a pro bono. So it's just a question of doing good networking and seeking for, these opportunities, and you will get them. And to reduce on the costs, of course, we are not paying ourselves. It's just the maybe transport from one point to another and so forth.
Okay, I think, thank you for that. You've taught us resource mobilization, advocacy in under 5 minutes. So, and you've also linked up people for them to be able to know where to go. I don't know if you can be able to type it in for them to be, to look for it in case they missed that specific point. Before I continue with the Q&A, I had a question for myself. Right now we're having so many earphones, from AirPods to buds to big earphones and what have you. And when I went to the ENT department, one of the nurses was like, "Why are you using these earphones? It's not really good." So I wanted to ask, have you seen a hike in adults, especially adults who have hearing loss that is attributed to wearing headphones? And if yes, which headphones are most advised, and for how long is it most advised for us to use?
Well, as a rule of thumb, anytime you have your headphones on, you shouldn't have your volume more than 60% of the volume. Most of these companies now, there is a check as to how much you can really put up the volume. So you should never really have your volume at 100%. It should be at least 60% of the volume. And to answer your question, yes, we have had people who come and they are, using their headphones at very, very loud. So they're beginning to get, the usual thing is they start off with things like tinnitus, which is a ringing sound in the ear and a feeling of being muffled in the ear. Hearing loss takes time to actually set in. And so sometimes it is so gradual that you may not notice it. So the early signs are usually feeling like a blockage in your ears or a ringing sound in your ear. And so that's really already showing that something is already beginning to happen. And that's when you need to go back again and see, are you using your headphones for too loud? And also, when it comes to, if you're using it at least around 60% and below volume, in terms of the duration, some people, especially who are in call centers, one of the challenges they get is otalgia, which is earache, just an earache. So for those ones, especially those who work in call centers, we say that you need to have some gaps between the calls just to give your ear, a rest, if you like. So really, it is just about how you use the earphones in terms of volume and the duration. If you use it for a very long time, even if it is not very loud, if you use like for 12 hours straight, you will, after some time, begin to develop some sort of discomfort in the ear or pain in the ear. So you need to take some breaks. 10-minute breaks would be good, especially for those who work in call centers. Thank you.
Thank you. That's great. So I'll match the next question with a question that I have. You mentioned blockage to be one of the early signs. So let's say you have wax. You go to you assume you're blocked because of waxes. Would that mean if you feel blocked and you don't have waxes, you're more likely to have an early hearing loss occurrence? And there was somebody who had asked about earwax, but maybe as you continue doing that, I will find that question. Over to you, Sarah.
Okay, there are many causes of a blockage in the ear. It can be an actual hearing loss. It can be, especially when you have a cold, we get what you call eustachian tube dysfunction. You may feel like your ear is blocked. So all of in terms of blocked ear, there are so many different causes, one of which is even, like you said, wax in the ear. And again, it could also be infections, but that again will come with maybe otalgia, you have discharging ear, and so forth. What I was saying about the sense of blockages, when you're exposed to very loud sounds, like for example, the people in the Jua Kali, I'll just give that as an example, when they come from, that a day exposed to all that noise, they feel the blockage in their ear. And naturally, if you did a hearing test on them, you'll find that indeed they do have a hearing loss. It starts off as a temporary threshold shift. That means a hearing loss that is temporary, but if they continue to expose themselves to that noise, it becomes permanent. So the thing is really, first of all, to take your history and see what is causing this blockage. Did you have a cold, for example? It could be, again, what you said, eustachian tube dysfunction. It could be an otitis media with effusion or an otitis media, chronic suppurative otitis media. It could be many different reasons. Coming back to wax is quite a common problem, especially also in school-going children. And the times we go out for ear camps, we find quite a number of them may have earwax. That is very simple. We just put in some hydrogen peroxide and do a syringing, and that's it, and they're good to go. So yes, wax is one of the commonest causes of that feeling of blockage in the ear. And the remedy for that is quite simple. Just soften the wax, and depending on whether it's impacted or not, have it syringed. What we do not recommend is sticking in those cotton buds into the ear canal, because when you do that, you tend to impact the wax more. And so we say that do not put any cotton buds into the ear canal. Thank you.
Thank you. I think you answered the other question. So let's go newborn, from birth. How do we assess hearing loss in newborn babies?
Thank you for that question. We're going to be having another talk that is 2 weeks from now on early detection of hearing loss in newborns, infants, and so forth, but I will still touch on it. It is possible to assess or to do a hearing screening on anyone, any child from childhood to old age across the life course. And so for newborns, we do what is called otoacoustic emissions test. This is we insert a probe into the canal of the child, the ear canal of the child, and the result that we get is either a pass or a refer. First of all, what are otoacoustic emissions? When the sound is being processed in the ear, it generates some energy. For normal functioning ear, it generates some energy which can be picked in the outer ear. And that is what is known as otoacoustic emissions. So for a well-functioning cochlea, you'll be able to pick otoacoustic emissions in the ear canal. It's a very, very quick test. It takes about less than a minute. As long as the baby is nice and quiet, you just place the probe there and then you're able to record the result as a pass or refer. Now, for those that refer, we then now give them a period of time. It has to be within 3 months where they go for now diagnostic assessment. And after the diagnostic assessment, if they have a hearing loss, then they go on for intervention. There is a principle that is called 136, which means that you need to do hearing screening for these children by about 1 month of age, and then diagnosis must be made within 3 months, and then intervention, if at all there's a hearing loss, within 6 months of age, because timely intervention is very critical to this child's development in terms of speech and language, and later on in life, of course, now the other things we talked about, which is academic performance and so forth. So yes, it is very possible. And as a matter of fact, in our strategic plan, one of the big things that we have put in there is a setting up of newborn and infant screening programs. So we want to have them in, of course, just before the child is discharged from hospital after birth, and also in the immunization clinics, we can do infant hearing screening there as well. There is still more. I know I'm going a little bit more than what you asked, but we noted that in the MCH booklet, there was no indication of anything to do with hearing in that booklet. And so that is also something else we are addressing, because all that is there in that booklet is ears. And so whoever is filling in the book, when you just see ears, well, you'd say if it's normal, you say it's normal ears, but you see the child may have congenital hearing loss. And that, of course, hearing loss is a hidden disability. You can't see it, you've got to test for it. And so that is where newborn screening comes in. And it's pretty simple, and it is something that we really need to start doing now. Thank you.
Thank you. So 2 questions on, we've spoken about newborns, and thank you for the elaboration and going above and beyond. It's quite helpful. The next one is on children. A lot of the questions are on shouting on young children and babies. Is it something that actually affects it may result into hearing problems for the children later? And on that note, is there any correlation between ADHD with hearing loss and I believe deaf, if that's what the person asked. Over to you, Sarah.
I'm not sure I got the question right. You kindly go say that question again.
Sorry, about shouting on children. Is it associated or correlated with hearing loss in children? Shouting at babies or loud noises for babies. Is it something that could actually result into a hearing problem?
Well, the thing is, generally, if you expose the child to frequent, sounds that are above 85 decibels for normal hearing, you will expect a hearing loss. But I think maybe what I would like to address, especially in relation to children and of course now ADHD, parents many times come with a suspicion that I think my child is not hearing. And many times, unfortunately, clinicians, we downplay that a lot and say, no, you're just being anxious, wait until later, your child is okay, they will hear you, just give it time and some, that kind of thing. So we would recommend that children basically, if especially the mother or caregiver has any suspicion about the child's hearing much earlier, long before even speech and language has developed, and the mother says, I think my child may have a hearing loss, I think it is important for that child to be sent to an ENT or an audiologist for hearing assessment. In terms of ADHD, unless we don't have a study specifically on them and as relates to hearing loss, but usually children with ADHD will come with a delayed speech and language. And sometimes some parents say that they want to, they like to beat on their ears and so forth and respond, when it comes to very loud sounds, they don't want to listen to loud sounds, they cover their ears and so forth. It could be that that child has normal hearing and that is just one of the, they could be having normal hearing, but they could also be having a hearing loss. And if indeed that child has a hearing loss, then we would go ahead and do all the things that we do for normal hearing, a child without ADHD. In other words, we'll do screening, and if they refer, we will go ahead and do diagnostics. And if at all they have a hearing loss, we go ahead and do the intervention, which can be either hearing aids or cochlear implants if they have profound deafness. So we don't even have any specific study to show that children with ADHD have more hearing loss than the rest of the population. So probably that's a good research topic.
Yeah, probably even a PhD topic, but thank you for that clarification. The fact that they have speech delays, in fact, that's the question that was asked about the association and correlation between speech delay and hearing for ADHD, but you have really answered more than we had expected on that, and you brought a lot of clarification. So moving on to now adults and even children in general. We've spoken about earbuds, but now on just normal speakers and loud things. What are the effects of loud music or when you're in a matatu, when you're in the house and probably it's a loud, or when you're in church and the mosque and it's the speakers are really loud. What are the advices and take-home messages from that? Over to you, Sarah.
Thank you for the question. We have legislation against very loud sounds, that is sounds that are over 85 decibels, because we know that exposure to that over a period of time, you will develop hearing loss. That is definite. The issue is just the implementation aspects. And starting even from a personal level where it's in your house, like you have mentioned, it's with in a matatu and so forth. You do need to be able to speak up, and this is where advocacy comes in. I'll give an example. I mean, you're in a matatu, there's very loud music. If 10 people in that matatu said no to the tout that, bring down this volume, they would. But the thing is that we don't have enough also public awareness on the hazards of exposure to loud sound. And this is one of the key messages that we want to send out there. In as much as the government is the main, implementer of this in terms of making sure that those matatus keep down the sound in the matatu, but we as individuals also have a responsibility for our own health. But it starts off from us understanding in the first place that that exposure will definitely give you a hearing loss in due course. And the cost of intervention, it is better to prevent than actually to intervene, because it can be also costly to do intervention, because the type of hearing loss that one gets as a result of exposure to very loud noise is irreversible, what we call permanent sensorineural hearing loss. And so where public, where people are informed about that, then all they need to do is just to regulate the noise exposure that they have. Where that is not possible, whether it is because of occupation, the nature of your work, that is where then you can use noise protection. You have earmuffs, and you also have noise plugs. What these do is that, say for example, the sound is 100 decibels, the noise plug or earmuff will bring that sound down by, say, 30 dB. That comes to 70, which is a safe level. When one is developing noise-induced hearing loss, it starts off as what you call temporary threshold shift. That means you feel your hearing goes down and then it recovers. But as it continues to be, you continue to expose yourself to that loud noise, gradually and eventually you will lose your hearing, and it is a permanent sensorineural hearing loss type. And that also one needs to remember about those who do recreational things like shooting, for example. You have to wear hearing protection, or even these fire crackles during festivities, you have to wear hearing protection. Yeah, thank you.
Thank you, Sarah. There's a lot of questions on waxing. Probably you can summarize, like why are more people susceptible to waxing than others? And yeah, over to you, Sarah.
Okay. Well, I think people are different. That's what we say. Some people are just susceptible to getting accumulation of wax, but there are also other things that can contribute to that. For example, patients who wear hearing aids, especially those who have what you call the ear mold, by virtue of putting in an ear mold every day, you are interrupting the normal process of clearance of wax from the ear canal all the way to the external canal where it comes down there. Wax just sort of migrates and comes out there, and you can clean it. So people who wear hearing aids, they have that challenge. The other thing is that people who like to put in, biro tops into their ears and, trying to clean the ear from wax, sometimes you may cause the wax not to have the natural movement and flow. And therefore, with time, the wax can just sort of impact in the ear. But generally, people have, some people just produce more wax than others. And I think the key thing is that if one falls in that category every so often, then just visit your ENT and they will be able to sort out the problem.
Thank you. I love how you've pointed out, if we chokora our ears, that's when we disrupt the natural flow. Majority of us like doing the opposite. So now somebody has developed the tinnitus and the blockage. Are these processes reversible?
Unfortunately, not. They are not reversible, but they are manageable. You can manage tinnitus. So if you had tinnitus, for example, which is the ringing in the ear, first of all, you want to find out what is the cause. Is it really a hearing loss that is causing it? If it is a hearing loss, then go ahead and, apply the appropriate management. If it, for example, that you have a conductive hearing loss that is due to infections and chronic otitis media or other ear infections, then you treat the infections and more than likely the tinnitus will abate. However, for sensorineural hearing loss type, the first thing obviously is to make a diagnosis, what is coming along with the tinnitus, what condition, because that condition has to be managed, whatever it is. Let's say if it is a Meniere's disease, for example, it is medical management for it. So if the tinnitus persists and there is hearing loss, then you can do a whole lot of things, one of which is we do tinnitus management and counseling to help someone to adapt to that. But sometimes it can be very interruptive and annoying, intrusive rather. And so we have certain special hearing aids, which we call hearing aids which have tinnitus maskers. That means it generates a sound that helps to mask that annoying sound that one hears. And then also a lot of therapy comes with that as well to help the person not to be able to sort of habituate to that tinnitus sound so that it stops being intrusive, annoying, and so forth. So we can't say there is a specific treatment for tinnitus in terms of it just not being there at all. It is more to do with managing it so that you are less aware of it and it is less bothersome. And so we use those kind of modes. If there's a hearing loss, like I said, you can use a hearing aid that corrects the hearing loss, and then you will find you're not experiencing the tinnitus as much. And if it's still a problem, you can have also tinnitus maskers.
Okay. Next is on hearing aids in terms of the pricing and also in terms of keeping up with technology, because I'm sure it has evolved, and probably now it's evolving even faster with the current technology. Is it something that are there programs available in Kenya whereby it's more cost effective for us to be able to access such high content, such high hearing loss gadgets? And also, if you have a sensory hearing problem, does hearing aids, sorry, if you get it, Dr. Zainab was asking, if you get it from, if you get the hearing loss from drug reactions, would a hearing aid help you?
Let me start with the last question. Yes, if you got a hearing loss due to medication, yes, indeed, hearing aids will be very useful. And when it comes to hearing aids, it depends on the level of your loss. So if you have, it's a range of hearing, so from mild, normal, mild, moderate, moderately severe, severe to profound. So depending on the degree of your loss, you can benefit from hearing aids. If the ototoxicity has caused you to have a profound deafness, then the best option for you will be cochlear implants. When it comes to hearing aids and the cost, this has been an ongoing discussion, and the government fortunately has now removed taxation on this. And so all in a way to bring down the cost. And this generally is, all the hearing aids, of course, are imported. We do not manufacture them locally. So it is an expense, but I think the ministry, and this is one of the things that we are addressing, even at the ministry level, where KEMSA will be procuring these hearing aids so that the citizens can have access to them at affordable costs. Because again, also when hearing aids are bought bulk buying, that also helps to bring down costs significantly. So I think the government is looking into that. And after even the launch of this strategic plan for implementation, as I said, that is one of the things that have been addressed. We are hopeful that at least the prices will come down at least, and also just to improve access to that. And technology is at all-time high, especially with hearing aids. Nowadays, we have healthable hearing aids that can even detect if you had a fall and send a message to your loved one. So technology has, as far as hearing aids is concerned, is at an all-time high, and it is ever evolving. And even in terms of how the instrument looks, it is beautiful, nice and discreet. It comes in all shapes and sizes and technology levels. But for the general mwananchi, we want a hearing aid that is a digital instrument that is going to allow you to communicate quite well. And as I said, the government is looking into bringing down that costs to what can be accessible to the larger population, and that really is the plan.
Great, thank you. A question from Douglas. What's your comment on EHC in pregnant women?
EHC in pregnant women is critical, and part of this you will see that antenatal care is important, because some of the conditions that will cause maybe, for example, and also medications that are taken by
Sarah, I've lost you.
That they need to volunteer information whenever they go for their clinics, that daktari, I'm expectant, so that even the doctor is able to make a good choice for medication and probably avoid ototoxic medication. So there are many risk factors that are associated with antenatal mothers, and that for the child developing hearing loss. And so also follow
Sarah, we've lost you again. Dr. Diana, can you hear me? Dr. Diana, I'm sorry, I'm picking on you. Okay, so we've lost Sarah. I don't think she'll be able to rejoin us, considering the time. However, thank you very much for listening and bearing with us. We'll try and improve all the hiccups in due time. On the poster is the series for Ear and Hearing Care Symposium. We'll have it every Tuesday for the next 5 weeks, and we hope we can learn more, share more, and engage more. For the PPB, the sessions will be uploaded next week. And for the some of the commonly frequently asked questions will be addressed in a short video. We'll try and upload it on our YouTube channel within the next 2 weeks. But please sign in with your unique identifier. And when you're registering, please register accordingly so that we can share the correct CPD points with you. And thank you very much. So I don't know, Sarah, if you don't mind, we started saying goodbye. So maybe you can give us a parting shot, Sarah. Okay, looks like she's still not back on, but again, thank you very much, everybody, for listening in. Sorry we are unable to address all those questions, but we'll try to address them over the next 5 weeks. See you soon, people. Bye-bye. Yes, and tomorrow we'll have the session on blood transfusion.
I am back. Amina, I am back.
Yes, so I was saying...
Amina, I am back, sorry.
Yes, Sarah, no problem. Maybe you can just give us a parting shot until next week, Tuesday, when we can have your team over.
Okay, so my parting shot is that ear and hearing care for all can be a reality, and that our aim is really to be able to provide this across the life course for every individual without them suffering financial hardship. So we have equity and access to ear and hearing care services, and we see this possible through the WHO model of integrating it into our primary care level of training. So join us on World Hearing Day, which is on the 3rd of March, and to make this a reality, to begin to make it a reality. We have lots of material, infographics. You can visit the WHO website, just Google there, World Hearing Day 2023, and you get a lot of resource material, including the training manual that is going to be launched on Friday. And also, we would like you to also join in the conversations that are going to be going on there and the World Hearing Day 2023 in the website of WHO. We have a lot of media things that we are doing, including TikTok, on Facebook. Kindly tag us along all the activities that we'll be doing so that we really are able to create awareness. It is great that the government is already on board and they are spearheading EHC in this country, but now we need also the primary healthcare workers and everybody, physicians, nurses, clinical, all people in healthcare to rally together in order to make this a reality. So thank you very much for your attention this afternoon and your questions. And once again, I apologize for the hiccups along the way in this presentation. Thank you very much.
Yeah, thank you, Sarah. It's been a rough road, but a great journey with you. Thank you very much for the wonderful presentation and for the invite to join in, even if it's virtual, on the World Hearing Day. I hope we can all get our ears checked, because after this session, I feel like I have probably early signs of hearing loss as well. So thank you very much, everybody. We'll meet you again tomorrow. Bye-bye.
You.